Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to be talking about the trending red light therapy. Red light therapy is something that we discussed in physical therapy school. It was actually one of those modalities as a physical therapist that wasn't necessarily utilized as prevalently as it used to be. And so it was sort of, in a sense, at least as far as I remember, it was being phased out. But it has made a resurgence. It is becoming more and more popular, more and more accessible, and it has some great benefits to it. And so we're going to talk about red light therapy and as it relates to headaches and migraines, if it's something you should pursue, and if so, what should you know about it, and how should you pursue treatment in this way. All right, so on this podcast, we are all about any type of treatment that, one, is natural. So when we think of the words functional or holistic, we're looking at the body as a whole and trying to understand what can we do to restore the normal functions of the body's systems so that we have a healthy lifestyle, so that we have our health to its full potential. Okay. Now, when it comes to medication, oftentimes medication falls into the category of artificially changing something that is naturally happening in the body so that we don't feel pain, we mask pain, we manipulate the pain signal itself. And so when it comes to natural ways to get maybe a similar effect to medication without the side effects, boost things like serotonin levels, the good sort of hormones or neurotransmitters, the parts of the body that help us manage pain. We're all about that type of stuff, but not necessarily as it relates to the pharmaceuticals out there, the side effects that come with them, the dependence that comes with them, and especially this message of take a medication and that's kind of all that we can hope for in managing the severity, the intensity of your symptoms, and without any answers or hope. Okay. If this is your first time tuning into this podcast, I want you to go back and search through the list of podcasts. You can use it kind of like a library resource to find topics that you are interested in and listen to those topics. I've got podcasts specific to migraine diagnoses that might be pertaining to your diagnosis. I've got podcasts talking about the most overlooked cause of headaches or migraines, which would be a big one to hit on. So go back, listen to previous podcasts. And what we're going to talk about here is more of a specific topical red light therapy, what to think about it, what to do about it. Okay, so first off, what is red light therapy? All right, so red light therapy is essentially a wavelength that is able to penetrate the skin and has effects on the cells themselves that promote things like tissue healing, cell energy levels, production of energy, things like that. Okay, and so there's a few different types of light wavelengths that are typically made up or that compromise what we know as red light therapy, because there's a certain type of red light that's visible that will penetrate the skin, and then there's a deeper, what's known as near infrared radiation type of light that actually goes beyond the skin and can penetrate even into like the brain or internal organs. Okay, now a couple things to know, more specifics. We've got the nanometer range, okay? So the wavelength range. 600 to 700 nanometers is going to be the visible red light. This is going to penetrate the skin surface, promote collagen, reduces wrinkles, acne, inflammation, things like that. Then we have the 700 to 850 near infrared radiation. This is reaching deeper into the muscles, joints, nerves, used for pain, inflammation, blood flow. And then you've got the 850 to 1100 nanometers, and that's the deeper near infrared radiation light that penetrates like the brain, bone, organ level at therapeutic effects. Okay. And so when we're talking about red light therapy, I thought this would be an appropriate topic because recently I've talked about the EDS, so Ehlers-Danlos, in combination with looking at something like prolotherapy. Prolotherapy trying to like jumpstart the healing process and promote collagen growth so that tendons and ligaments become stronger. So if you haven't listened to that podcast, go back and listen to that. And prolotherapy, it's kind of maybe a newer type of therapy that's becoming more popular as well. And so when we talk about visible red light promoting collagen, that's going to potentially have a similar effect. Collagen is going to strengthen things like ligaments and tendons. And then I also did a podcast pertaining to nitric oxide. And so there's an impact of red light therapy on nitric oxide as well that we're going to hit on. And so it felt like I had been hitting on topics pertaining to nitric oxide and the benefits of nitric oxide as far as like vasodilation, blood flow, increasing the parasympathetic nervous system, so that rest and digest state. And then also as it relates to prolotherapy or just these sort of other types of therapies that seem to fall right in line with what people are finding is beneficial when they go through a red light therapy treatment. Okay, so we're going to talk about a few of the main impacts on the body that red light therapy would have. So first off, we want to understand that red light therapy is safe. So when I say things like near infrared radiation, that term radiation is like, okay, radiation is bad. So red light therapy is non-ionizing. So that's different than like the UV or X-rays. So it won't be damaging to the DNA. Now, of course, in let's say 3 or 4 weeks, something like that, I have an interview with the CEO of one of the largest and most prominent red light therapy manufacturers. And so what he'll talk about is the FDA approval process and how most of the red light therapy products on the market are actually not technically approved by the FDA, but their product is one of the only products that has gone through that process, the appropriate channels. And so stay tuned for that podcast because he'll get more into details of like what product specifically you should be looking for. And that'll be helpful when you're, starting to search on the market for red light therapy, maybe a studio, a massage studio, a gym that, carries this type of product, or if you're just looking for an at-home device. But anyways, we have, first off, the benefits of red light therapy as it pertains to nitric oxide. And so nitric oxide triggers vasodilation, which when it comes to healing and blood flow, we need blood, we need oxygen in order to heal. And the channels that the blood flows through, the bigger they are, the more blood that we will receive. So that's what vasodilation is referring to, is a widening and expanding of those blood vessels. And so nitric oxide is a good thing in this scenario. So we want more nitric oxide. We want our body to be able to utilize the nitric oxide that it has. And then we want to maximize that so that, and if you go back and listen to the podcast on nitric oxide, I talk basically about how there's different avenues that our body produces nitric oxide, whether that's through breathing through our nose, the saliva, the pH of our mouth, the good bacteria in our mouth, and then a few others. But essentially, we want something like red light therapy to have a benefit as it pertains to nitric oxide, because nitric oxide is going to help with blood flow, and then it's going to potentially help ease neurovascular spasms. So that could be the pounding, throbbing impact you might experience with a migraine. So oftentimes people will say that they'll have a pulsating type pain in their head. The blood vessels that surround the brain can become sensitive. They receive nerve innervation on a similar channel as the upper neck and the occipital nerve, the trigeminal nerve. And so basically the brain is getting input about what's happening in those little blood vessels from these other parts of the head as well. So they all travel through the same channel into the brain. And so the brain can have this sense of, the blood vessels around the brain are sensitive, they're hypersensitive. And so if there's a vasoconstriction or a spasm of those blood vessels, that can be something that leads to that pounding, throbbing sensation. So something like nitric oxide, dilating those blood vessels, relaxing them, can be helpful. And then we look at nitric oxide as being displaced during a red light therapy treatment from what's called cytochrome C, which is going to boost cellular respiration and blood flow. Okay, so we're looking at the ability of the cell to basically function how it should, releasing of nitric oxide that in a sense was trapped. And so when it pertains to nitric oxide, red light therapy helps to release the nitric oxide that's already in our system and allowing our body to use the benefits of that nitric oxide effectively, which we know can have a positive impact on migraines and migraine symptoms, specifically as it relates to the blood vessels and then your ability to get into that rest and digest state instead of everything being in that fight or flight, which has mostly benefits when it comes to pain management. Okay, red light therapy can also have benefits as it relates to serotonin modulation. When we look at migraines and the treatments for migraines, a lot of the pharmaceuticals are impacting serotonin, okay? So serotonin is going to be so if we take something like a triptan, so, whatever your brand name medication is, sumatriptan, rizatriptan, a triptan is going to be a serotonin agonist. So we're trying to mimic the effects of serotonin, and serotonin is a pain modulator. So it helps mitigate, reduce the impact of the pain itself. And so we're sort of like manipulating what you feel in a sense, but we want serotonin to be prevalent. We want to utilize serotonin. And so serotonin deficiencies or serotonin dysfunction can lead to lower pain thresholds, meaning you're more sensitive to pain. And so we want your body's response to pain to be appropriate. And so increasing serotonin release is a good thing. That can impact mood, pain thresholds, and migraine triggers. So you won't be as necessarily sensitive to all the little migraine triggers that that your body has responded to historically, potentially. And so serotonin being released through red light therapy is a good thing. In a clinical study, 2016, in experimental biology and medicine on tension headaches, they showed that serotonin modulation and significant pain relief was a result of red light therapy. All right, so we've got red light therapy impacting nitric oxide. We've got red light therapy impacting serotonin. We also know that red light therapy impacts ATP production. So ATP is it's like the energy. It's what the cell uses to provide it with the energy that it needs to function and however it was designed to function. And so the cell requires ATP. And it creates ATP in order to live out its function. And so something like red light therapy, being able to impact the cell, not just at the skin surface layer, but at deeper layers of our tissues. So beyond the skin, if we get into muscle, if we get into joints, if we get into tendons or ligaments, and being able to allow the cell to increase its ATP production is a really good thing, is a helpful thing. And so that can lead to increased healing times, reduced inflammation, increased blood flow, a lot of good things when it comes to the body dealing with chronic pain, chronic inflammation, joints that are swollen, things like that. And so there's a lot of benefits when it comes to the local cell mitochondria function, ATP production, and red light therapy is able to tap into that. Okay, so we've got a study here that looked at the it was a trial including two groups. So we had migraine was a constant in both groups. One group received the treatment of Botox, and then it was compared to low-level laser therapy in the other group. Okay, so they looked at pain intensity, drug consumption, like their reliance on medication, and anxiety and sleep disorders. And so the outcome was that both groups were able to reduce their headache days, their need for acute medication intake, and then the intensity of pain. Anxiety was reduced in the Botox group, while sleep disturbance was reduced in the low-level laser therapy. Okay, so essentially this is light therapy versus Botox. And what's encouraging about this is I do have another podcast on Botox. I'm actually not a huge fan of Botox. And so listen to that podcast so you have context for this portion of the podcast. But essentially, if low light therapy or red light therapy can have low level laser therapy or red light therapy or light therapy in general, if it can have a similar impact as Botox. Botox is a toxin injected right into the muscle. It paralyzes the muscle, so it makes it so like a component of your musculoskeletal system, a component of how you move, and likely a muscle that was needed but was just overworked, fatigued, and kind of angry. If we just shut that muscle off, there are implications of that, negative implications. And so Botox is not necessarily as far as what we're concerned, it's not a recommended treatment approach. But if we can get a similar effect comparing red light therapy to Botox, and of course there's more studies that are needed. There's bigger studies. There's more randomized controlled trials, systematic reviews, like the big type of data that actually changes clinical practice is definitely needed when it comes to red light therapy. But even if things like this are true, and if you yourself are able to access red light therapy, go through it, and see a reduction similar to Botox, and you can start weaning yourself off of Botox, that would be a huge win. And the benefit of this is you don't need a script or you don't need a doctor to tell you to go through this process. It's very accessible because it is a safe form of treatment. And the technology, like I said, we'll talk about that in about a month or so. But FDA clearance, that is one thing to consider. But it's more so, my understanding is its clearance. If it doesn't have clearance, it's more so of an issue of it not even being effective, not penetrating the skin and going as deep as it should. Not necessarily that it's going to harm you. It's just sort of claiming to give you benefits, but it might not be. Okay, that's my understanding so far. But a lot of this, I am sort of learning with you guys. And so trying to stay ahead of it, provide you guys with insights. But that's my understanding of the market, of red light therapy, and some of its benefits. And then, that study that's comparing it to Botox. And so if we can use light therapy instead of Botox, let's definitely go down that road. There's definitely anecdotal evidence out there. So stories of people with migraines that find relief from it. And you can find those over the internet, social media, things like that. There's a lot of influencers that are promoting red light therapies and their benefits. It could be for skin health, reducing joint pain, things like that. But I would be interested to see who out there is able to go through it and find some relief for their migraines specifically. So feel free to reach out and let me know if that is you. Okay. Now, what does it mean as far as going through like the application of it? So let's say you want to try this out. What I would say is I'm not an expert in red light therapy, so I want to qualify that. But it seems intuitive to me that the more accessible approach would be to buy some sort of wand or handheld red light therapy device, using it on your temples, on the upper part of the neck, wherever the source of pain or tension or irritation is. For a lot of people, that's going to be the upper neck. I think there's also, my understanding is using something like a full table, so a full body red light therapy, can get a lot of the systemic effects. You get the systemic effects to a greater extent. Okay, and so a lot of the benefits that I talked about are not necessarily to the local tissue, although there is benefit to applying red light therapy to the tissue locally. But whether it's like nitric oxide or serotonin, those are things that systemically, if they're more readily available, can be helpful. And so something like a red light therapy table might also be a good avenue. Okay. Start with potentially more low power, like focused or focal sessions, a couple times a week potentially, and positioned over the forehead, temples, that sort of thing. Most red light therapies are, like I said, a combination of the visible light, that like 600 to 800 nanometer range, and then they have the near infrared radiation, which is more of that higher 700 to 1100 nanometers. So there's like a combination of the visible light, which doesn't penetrate as deep, and then the deeper penetrating light. So getting both of those, and then a couple times a week, something like that. Like I said, I'm not the expert in like the application or frequency of this, but I think part of it is potentially anecdotal, and you, in your personal experience going through this, seeing if you get benefit. Okay, so just to kind of wrap up here, the overview here is that red light therapy is very accessible. It's a safe approach, definitely safer than medication. So we're basically reducing the risk of side effects, and then we're getting value in it by increasing nitric oxide, ATP production, serotonin. Okay, and all those things are good. They allow the body at the cellular level to heal, so local tissue healing, and then it can help with whether it's serotonin and pain management, or nitric oxide in creating an environment where you can sort of see the blood vessels dilate, get blood flow to the area, and then put you in that rest and digest state. So all good things when it comes to, man, I just feel like I'm wound up all the time. I'm always on edge waiting for my next migraine, that sort of stuff. Okay. Now there are small but meaningful studies to back this stuff up. And so I encourage you to do your own research to understand this better. Non-invasive, it's safe, it's home friendly. So a lot of positives here. I would consult your healthcare provider if you have something that you're concerned about and you're like, hey, I don't know if this is right for me. It sounds cool. Make sure that you don't have any condition or reason that it would be contraindicated. But as far as I'm concerned, it would be something that's worth a shot. Now, just to provide our perspective and lens on something like this, what I'm saying in this podcast is not that red light therapy is going to solve your problem of your headache or migraine. Now, red light therapy is providing benefits to the body so that you're better able to cope with the underlying issue that's eventually leading to your head hurting, or you having an aura or pain behind your eye, however your migraine presentation, however your headache or migraine presents. Okay. So this is the type of thing that would be helpful, especially if you don't live near us and can't necessarily readily get to our office, or you've struggled to find someone in your area. We, of course, have our virtual coaching. We have the SAM device. We have the opportunity to come in person. But this is something that may be helpful as you continue down this journey of actually finding and treating the underlying problem, which for most people is going to be a neck, jaw, shoulder issue. And more specifically, the upper part of the neck is like the common thread that is the most overlooked cause of headaches or migraines, okay? And so we're dealing with a neck issue, an angry neck that's sending pain up into the head in most scenarios. And so the environment that we experience the pain in is going to be impacted by something like red light therapy in a positive way and can have benefits, okay? So we're talking about threshold here, your body's ability to cope with this pain signal, all right? And so if there's a safe way that's accessible in order to provide an environment where you can cope with this underlying problem while you continue to seek treatment for that problem, then that's a good thing. Or maybe it's something it's used in adjunct or alongside treatment for your neck, jaw, or shoulders, okay? So not in replace of, but to partner with you on your journey of actual true underlying relief of the problem. Okay. That's important to understand because I don't want these podcasts to be confusing as, hey, we're promoting this as like a viable option. Okay. You don't have to necessarily worry about your neck if you just do red light therapy. Because I think that would be a miss. And I don't understand it that way. And I don't think that's necessarily the appropriate way of looking at it. But red light therapy, I think, can be a good option. And this was fascinating going on my own journey and understanding this better. And stay tuned because within the next month or so, we are going to have the CEO of one of the biggest manufacturers of red light therapy on this podcast and get to know him and learn more about the industry and what can be helpful for you from his perspective as it relates to headaches and migraines, and then just understanding the equipment itself and what's safe, what's to watch out for. Thank you guys so much for listening to the Headache Doctor podcast every week as we continue on this journey to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.